Well, welcome everybody, and thanks for being here. We really appreciate it. My name is Steve Valente. I'm the IDD director. Um, I've met a handful of you folks, or many of you, but we know everyone's really busy, and it's hard to find time to squeeze in a meeting like this. So we're really thankful and genuinely excited that you're here and you chose to spend a little bit of time with us today to go over some of these things. We're really looking forward to sharing what's ahead, and so we can make a smooth transition for you. And I also want to note that we're super grateful for the responses that we received from the survey that was recently set out. The feedback was actually very thoughtful and helpful, and it really directly helped to shape and the information that we'll see in this presentation, or a great deal of that as well. So today's informational session is just going to be a high level overview, walk through the transition from employee to independent contractor, sort of why we're making this change, um, and what some of the changes are and sort of what some next steps may be. Okay. A couple of quick housekeeping things just to keep us on track for this meeting is we have a pretty full agenda, a lot to cover, and we don't have a ton of time. So I'm asking you to please just hold questions until the QA portion of the session toward the end there, and then we'll do our best to get those questions answered. And then also in regards to that QA session, I know everyone probably has some very case-specific questions, and those are really, really important, and we want to make sure they get the attention that they need and deserve. But we just won't have time today to answer all of those details. So please, if we can just try to keep those questions to sort of big picture generalized questions. There will be time for us in subsequent trainings through the next coming weeks, or if we need to set up some individual meetings with each of you to walk through some of those particulars, we can certainly do that. Okay. It's just today we're a little bit limited on time. So I really appreciate that. All right. If we can do the next slide, please. Okay, let's do a quick round of introductions. So I just introduced myself. Michael Kelly is also on the call. Michael, most of you know, I sure hope you know Michael Kelly. He's heart and soul of our department here. So he's our IDD manager. Holly Peugeot is also on the call. She's our benefits specialist. She's been with us a long time. Many of you have probably spoken with her, interacted with her over the years. And then we have Stacy Osborne from Beneficent, who's here for some general support related to independent contractor guidance and maybe some gathering resources to help you with tax management, however that's applicable. And then we also have Indira Guzman, who's on for language interpretation. Okay, next slide, please. All right. So let's talk about a little bit of what's going on here. What is this change? What does it really mean? So let's talk about what's an independent contractor. All of you probably know what a W-2 employee is. That's what all of you are currently, or you have been at various points in your life. So an
Steve,
independent.
I'm so
Oh,
sorry. Don't mean
yeah.
to interrupt. Can we turn on we need to turn on the interpretation. So if we can just have Indira just do a little bit of a quick intro,
Oh,
and
sure.
that way for any Spanish speakers, that language interpretation will be turned on. So if we can just pause for a second, that would be great.
Yeah, you got
Indira,
it.
turning it over to you. And I think that is all in the chat, what she wrote there. So I am going to turn the interpretation on right now. Hold on one second, and we'll get this all set up here. I think we're all good. Fantastic. So everybody should be able to hear in Spanish. Thank you so much for pausing, Steve.
Yeah, of course. Thank you for letting me know. Okay, so what's an independent contractor sort of versus what's an employee? Independent contractor is somebody that works for themselves. They are not an employee of the organization. They contract for the work that they're performing. They're paid to provide a service as opposed to a salary or an hourly wage. They will receive a 1099 tax form instead of a W-2 at the end of the year when the tax season rolls around. And an independent contractor is generally responsible for handling their own tax payments if there's anything applicable to that. Independent contractors are not eligible for employee benefits such as health insurance and dental insurance, so on. But an independent contractor is someone who is able to control the means of production and how they do their work and when the work is completed. As long as you guys are doing that within the confines of the rules and regulations as set out by the state of Colorado, It's up to you how you want to do that work. Okay. And so why PASCO? So we're going to talk a little bit about what's going to stay the same, what's going to change, and there's a couple of key things. There's a whole bunch of stuff, and we'll talk more in detail throughout the coming weeks. But there's some things we want to mention here. One is we're still committed to making sure you guys get paid on a weekly basis. Okay, so we're working behind the scenes to make sure that that's happening. We're going to be simplifying the sort of time in and time out, if you will. There will be no more clocking in or clocking out. It's going to be all done via an attendance model. And we'll show you how to do that in TheraP in our subsequent training sessions. It's actually very simple, and I think you guys are going to really like it. And then we're also committed to making sure that we're making this transition as smooth as possible and as seamless as we possibly can, with some resources related to health insurance changes and options, resources for tax management, and we have the transition team that's always available to help you through this if you have any other questions. So kind of what stays the same? Um, Most everything else stays the same. You're still going to have a service coordinator. You're still going to have a nurse if you have that as part of the services that you get. So we're still going to be coming out and doing our quarterly visits or more often as needed. We are still responsible for maintaining overall quality and compliance related to state rules and regulations. So we'll be providing all that clinical oversight. And we're still here as emergency supports and contacts if you guys need that. And of course, we're always going to work for long-term advocacy and planning for you and the person that you support. And then, of course, on the general sense, we continually work on advocacy efforts, throughout Colorado as things change on a daily basis. Okay. Next slide, please. All right. So this is the key thing that most people are talking about. Let's talk about some rates. This is really related to the sort of why and how it's kind of all shaken out. And from our survey responses and conversations that we have had with many of you, this is generally the biggest question that people have. And our goal is to be clear and straightforward as we can with this and make sure that you guys understand how the compensation works under the independent contractor model. Okay, so from moving forward, you would be paid on a daily rate. And these are going to be what those rates are. As you can see on the slide, by making this change, we're able to adjust the rate from 63.3% to 68%, meaning that's what the portion that you get paid. Okay, so you're getting a larger portion of that daily rate moving forward. Okay, and the reason we're doing this now and why it feels so urgent is because the state has implemented or is going to be implementing this 8% rate reduction in the family caregiver rates that came out through an executive order by the governor in October. And so it sort of forced us to accelerate the entire process to make sure we got this done to make it work so it's benefiting you. This change should help to offset some of the impact of the rate reduction, and it will allow us to increase your rate. And it also truly aligns the work that you're doing to be more in line with how you're actually doing it. So it's going to be more reflective of what an independent contractor actually does, and the work that you're providing actually functions more like that. You can see here on this chart too. Oh, sorry, go back. You can see here on this chart too that it's broken down by Denver and non-Denver. Because if you don't know, Denver County has some specialized rates. That's just the way they do it here. Okay, so if you don't live in Denver, then that applies to the non-Denver or outside of Denver. And if you happen to live in Denver County, those rates would apply to you there. I'm not going to go through the rates. We can have this presentation available for you, and you guys can take a look at that as you need. Okay. All right, next slide, please. Okay, so let's see here. We're going to do sort of a side-by-side comparison. Let's take a look at a W-2 versus a 1099 contractor paycheck comparison. Now, this actual slide is just an example. It's not an actual real person or anything like that. It's not specific numbers. It's just an example, okay? But you can look at this and you can see that the gross earnings are the same. They're right here, $1,512.80. As a W-2 employee, you have a number of deductions, as you can see here. And those total deductions equal this amount, $504.44, in this, just again, in this scenario, meaning your net pay, your take-home pay would be $1,008.36. With it, the way we're going to do this with the 1099 contractor is here's the gross amount, but these deductions don't apply. Thus, that means you actually keep an additional $400.44 in your paycheck. Okay. So now, however, you may, again, you're responsible for managing the tax withholdings and quarterly tax payments if it's applicable. But theoretically, this is more money in your pocket. And we believe that the earnings that you're making here are subject to the difficulty of care compensation and uh, are not subject to taxes. So just keep that in mind. Okay. So this is a real world example. Again, we can't give you the tax advice, so we're going to really strongly encourage you to seek guidance from a qualified tax professional. Okay, so next steps. We're going to have some trainings coming up. So we ask you to attend one of the virtual contractor trainings or all of them if you want. Okay. In those trainings, we're going to talk about the changes to TheraP, which are pretty minimal and pretty easy. Otherwise, your day-to-day TheraP related stuff won't really change. Okay. Oh, bless you. Um, And then we're also going to talk about the shared living guide, and we'll talk a little bit on the shared living guide here today, but not too much. We'll explain what that is. We'll also have you fill out a W-9, and some of you may be asking, well, what's a W-9? Well, W-9 is basically simply it's an IRS form that gives us the basic information that we need to be able to pay you as a contractor. Okay, and then we'll have you sign. We'll review and have you sign the shared living guide. And what's a shared living guide? Actually, let's go back a second. What's shared living? Shared living is just a sort of all-encompassing term that is used throughout the United States to sort of talk about this kind of living arrangement, where there is a person in services who's receiving supports by a paid caregiver, and they live in the same location. Okay, it's a sort of a generic term for that. And our guide is going to, or the manual is going to explain in a little bit more detail how all of this is going to work. It'll be a reference guide for you guys to use moving forward. Okay. And then also related to that is we're going to have that contract. When we talk about being an independent contractor, um, we have it when you're an independent contractor, um, you have a contract between us and yourself. And essentially, that just means it's a legal agreement between us that indicates what the roles and responsibilities of everybody involved are in this shared living agreement. And we'll go over that in more detail too at a later date and get you up to speed with how that works. Okay, and so another thing that we need to mention here too is some of you, besides doing the IRSS or the residential component, you guys also do the supported community connections piece. And long story short is you can't really be an independent contractor and employee at the same time for the same organization. So we're going to have to make adjustments to there. We're going to have to find a secondary caregiver to handle those SCC hours. Now, if this does apply to you, this you should have been contacted already. Somebody from our team would have been in contact with you, and some of these cases are fairly complex, so we'll be working with you over the coming weeks to make sure that we figure out a way to make this work for everybody that's advantageous for everyone. Okay, and with that, I'm going to go ahead and hand it over to Holly, and she's going to talk to you a little bit about the benefits related changes.
Yeah. Good morning, everybody.
Good morning.
So I'm Holly, the Senior Benefit Specialist here at PASCO. So basically, if you have benefits currently with PASCO, so that, medical, dental, vision, anything like that, those benefits are going to be ending on February 28th. That's going to be your last day of coverage. So you're going to want to make sure that you have coverage in place effective March 1st. I did send an email out yesterday to those of you that do have insurance with us. And in that email, it outlines different options that you have if you don't have, like another plan that you on a spouse's plan or anything like that. So you can go to the exchange, you can find independent plans. I kind of outlined all the different steps in that. So if you have any questions, you need anything, please don't hesitate to reach out to me. I'm here to help guide you through this change. And I'll be sending out a few more emails too, just kind of reminding people, to get their stuff done.
Thanks, Holly.
Uh-huh.
Okay, next slide, please. Okay. So we've got some important dates coming up that you want to pay attention to. We're going to have some contractor trainings. They'll all be like Zoom, like we're doing here. We're going to do them on January 23rd, 10 a.m. and 6 p.m., January 27th, 10 a.m., 6 p.m., February 3rd, 10 a.m. and 6 p.m. You can scan the QR code there if you want to RSVP. You can do that now. That might be a good time to do that. If you can, again, we can get this presentation out to you, and you can go ahead and do that there. What we're hoping to do is have all of our forms and all of our documents completed and signed by February 16th. If you need any printed copies or anything, we'll be happy to get those for you. As you can see, the contractor trainings are coming up quick, and they're going to be all in succession in kind of a hurry. We want to make sure we do that so we have adequate time to make any adjustments or anything that needs to happen, basically through the month of February, to give us a little bit of time to make sure we work through some of these subtleties and nuances if we have to. Okay. So again, as Holly mentioned, February 28th is the last day that the health insurance and benefits will be effective. So you want to make arrangements between now and then. And then March 1st, this becomes effective. Um, yeah. And I think that's about it for the overall presentation. That leaves us to the point of where we're able to answer questions. We can open that up. And again, I just want to thank everybody for being here. And again, if you have questions beyond what we can even do today, if you have questions that you want to talk to me specifically about, please feel free to reach out to me, reach out to Michael. You can reach out to your service coordinators. And if they don't have the information for you, they can help get you to the right person. Okay, do we have any questions here?
Yeah. Oh, sorry. Go ahead.
Go ahead.
Okay, I'll go. Sorry. Hi, it's Kent Dixon, and yes, Michael did call my wife because we're one of those use cases that you talked about where we have SEC and IRSS. But the question I had about that is, so are you saying that one of those will remain an employee and the other one will be a contractor, and that's why they can't cross-pollinate, as it were?
Yeah, that is one simple way to do it, is to just have somebody do the IRSS and somebody else do the supported community connections, if that's something that you can work out. But there are other ways to do that depending on your particular situation, because these are as varied as there are people. So we could meet with you individually to talk about the specifics, but essentially, yes, that's it. Somebody would be doing the supported community connections and somebody else does the IRSS services.
Okay. Yeah. Well, we can follow up and get some specific questions taken care of. So, all right. Thank you.
Thanks, Kent. Kent, what's your last name?
Dixon.
Got it.
I have a question. So for the training of the CEUs, are we still do we have to go find that out on our own, or is PASCO still gonna send that to us once a year?
PASCO can still send that to you. The CEUs shouldn't change. As an independent contractor, you are able to go get training from any source if you want to. You can, as long as that training meets the state requirements, you can go get that training and you could supply that to us as long as you provide with a certificate or something. But we'll continue to offer the same trainings and you can take that way. It's really your choice as an independent contractor. That's one of those things where you are allowed to to make those choices as to how you want to do it.
Right, but see, we have to pay if we go somewhere else. So do we have to pay to with you guys?
No, it's still going to be offered as a free resource.
Okay, great. Okay, thank you.
Yep.
Yes, I want to ask question. My name is Shioma Shibez. Now that we're independent contractors, if we should call PASCO office, can somebody attend to us, answer our questions?
Yes. Yes, there's no change in that. You still have the same level of supports and services as you normally would. The day-to-day operations for you on a practical basis is going to be nearly identical. really the only change, those folks that experience the changes with the SCC are the ones that are going to experience the most change. Everybody else, you really won't even notice that we've made this change, other than clocking your time will be easier.
Another question. Thank you. Another question. How do we know now that we are gonna be the one to determine the tax? How are we going to know that we will pay tax? Is it at the end of the month or at the end of the year? Because we don't want in a situation that IRS will be, following us at the back, that we didn't follow the rules and regulations.
Yes. If I understand your question, currently PASCO still doesn't provide tax information and tax guidance for you, even as an employee. So ultimately, as an independent contractor, what we recommend is that you consult with a tax professional. You may want to do this now. You may want to do this closer to the end of the year. Again, it's entirely up to you to make sure that you fully understand any implications or tax liabilities that you might have.
And if I can just add, Steve, just
Yes.
quickly, I did put in the chat a Word document for a CPA that we refer our clients to. We're helping people get qualified for long-term care Medicaid. And we have clients that are in this independent contractor state, and they provide advice and consulting. And I did speak with Katie yesterday. She knows this meeting is happening, and they are willing to answer your questions for you and give you guidance from a CPA that does this. They're a national firm, and they're large in Denver and Colorado Springs areas. So that's a resource for you guys. If you don't already have a CPA of someone you can call and ask questions to.
I have a quick question about the pay rates, the daily rates.
Mm-hmm.
So if we are allotted 40 hours a week, and you said, so that was based on your rate of pay, correct? And so now it's just a daily rate based on the yellow highlighted area. Do we still bill for the 40 hours a week, or is it just the daily rate times 5 then?
It's just the daily rate. So this is one of the things that we're going to want to try to shift our thinking upon is not thinking about it like hours, right? We're going to think about it like a daily rate. So basically, yes, we will take that daily rate and multiply it by the number of days that service was provided. And then pay that on a weekly basis, just as we always would. And it's a simple matter of basically going into therapy, and you're essentially going to, check a box that says, yes, we were here today. And we'll be able to see if you did a Medicaid billable service, such as passing a med, doing ADLs, a feeding, anything like that is going to qualify as a Medicaid billable service. And we see that, we'll be able to initiate that payment, and it will just come as a daily rate rather than an hour. We're not going to have to do any of that fancy math to take the daily rate and convert it into hours, which is what we've done thus far. It'll make it actually far simpler to do.
Okay, so technically, in a sense, by billing the daily rate, you can get more than, is that what I'm hearing?
Not necessarily. No, not exactly.
Not necessarily.
Because I think about it like a pie or a pizza pie or something, right? Like the size of the pie isn't really changing. It's just kind of how we're carving it up.
Okay.
Right. And instead of carving it up into like slices, it's going to be the whole pie.
Okay.
Minus, of course, PASCO's admin fee and so on and so forth.
Gotcha.
But otherwise, that's the way I kind of think about it.
All right. Thank you.
I'm sorry. This is Wilma Jones. I have 2 questions. Can you guys hear me?
Yeah, we can.
Okay. What's going to happen with sick time and vacation time? How
Right.
do we accumulate those, or what happens with those?
Yeah, as an independent contractor, you don't qualify for the employer-sponsored benefits such as sick time and PTO. So there really isn't a way to accrue those. The idea would be the additional dollars, as we went through that slide that showed the additional $500 that you'd be keeping. You could take that and try to maybe put some of that aside for a vacation or sick time, but otherwise it does not accrue that way. I don't know, Holly, if you have anything you want to add.
Usually in the past, my daughter has been hospitalized a lot of times, so I would use my sick days, to make up. So now I totally get you that I would have to actually save, the amount that I'm going to be incurred in case of those times.
Correct. Correct. Because if she's in the hospital or out of services in some way, you would not be able to bill for that because the hospital would be billing for that.
Correct. Okay.
That's correct.
All right. Sounds good. My next question is, how do you I see like with the pay rate there's levels, like up to like 6. So how do we know what level we are?
I'm sorry, how do you know what level you are?
Yeah, I was looking at the pay rate, the slide with the pay rate. I think it said like grade 1 or level 1 all the way to like 6.
Correct. So that should be in your individualized service plan. And we can certainly work through that. Again, I don't know what everybody's levels are off the top of my head, but Michael, your service coordinator, we can work with you to make sure you understand what level you're currently at.
This level? Is that the SIS level?
It's a tier level is what it is.
Right. So can I ask another question?
Yes.
What if we are currently working to maybe we are in level 5, maybe we are trying to go to level 6, for example, and now that we are independent contractor, is it still going on? Is it going to be happening, or what is going to happen now?
Absolutely. We would still advocate and work with you and your case management agency and your case manager. We can still fill out all the required documentation from when we're trying to do a tier level increase. We can always assist with that. That's one of those things that isn't going to change. We still offer that level of support.
Thank you.
Really quick, Steve. It's Cara Delgado. Hi, everyone. I quickly wanted to address the question regarding vacation payout. We have a couple questions in the chat regarding vacation. And any vacation, I just want to reiterate that you have accrued leading to the transition, you will be paid out. That will be cashed out and paid to you during the time you're transitioning over to 1099. So any vacation accrual that you have thus far and anything you accrue leading to the transition will be paid out prior to the transition to 1099.
Thank you, Kara.
I have a question. Priscilla Smith. I wanted to ask, if I stay the current family caregiver, will that change in the future? I have to go to the 1099s?
I'm not sure I understand the question. Could you repeat that?
Currently, I want to stay. If I want to stay current family caregiver instead of switching over to a 1099, is that possible that I can stay at that and not do the, or is it going to be mandatory to change it to a 1099 in the future?
Right. So simply put, no, we are making this change, and everybody who is a current family caregiver will make this change. That really isn't an option. And it's a distinction in terms of how you're talking about it. The family caregiver in this case, is a 1099. They're kind of interchangeable in that sense. A family caregiver is just, sort of another way to describe the position that you're doing. It's more like the job versus the 1099, which is purely just the tax classification.
So I can't stay a W-2?
That's correct.
Okay, because I'm not a fan of 1099s. because you have to pay your own taxes, get your insurance, and all of that other stuff. So all of this will take effect in February.
March 1st. Yeah, we'll be making these transitions over the next few weeks, next 6 or 7 weeks here, and by March 1st, this should be in effect.
Okay. Thank you.
How do I get on to talk?
Sorry, I have another question. Paid leave, sick leave. I have some sick leave there. Now that we are switching over to independent contractor, what's gonna happen to it?
Right. Oh, sorry. Kara, were you going to take that one again?
Yep. Hi, Shiona. It's Kara. So regarding your sick and vacation pay, so vacation will be paid out upon the time of transition. So any vacation that you've accrued thus far and anything that will continue to accrue until the transition, you will be paid out for your vacation pay. In our policy, sick pay is not paid out upon the transition. So vacation will be cashed out and paid to you in your final check as an employee prior to the transition over to 1099.
So the sick leave will disappear. The hours there will disappear.
Yes. So we will cash out any vacation pay that you have accrued. Sick paid will not be cashed out upon the transition.
What of the money we have been saving, like I don't know, 401 or whatever? What will happen to it?
Yes. So Chioma, I'm happy to meet with you one-on-one alongside Steve and Holly regarding questions that pertain to your personal benefits.
Okay, thank you.
You're welcome. And I believe, Vicky, you had a question that you wanted to ask. So if I could pass it over to you, Vicky, if you still wanted to ask your question.
Thank you.
Yes, of course.
Yes. I wasn't sure how this worked. Hi, Kara. So I actually have a couple of questions. My first question is about my respite. Will I lose my paid respite through PASCO?
Yeah, we should probably talk offline and talk about the specifics in your particular case, Vicky. But simply put, the answer is no. We just have to figure out a way to make sure that we're doing that. If you have a respite provider who provides that respite service, again, I don't know what your particular case is, but let's suppose it's somebody who comes in and stays the entire weekend or something. What we could do is enter into a contract with them as well. And then they would be the independent contractor for those couple of days, and that pay would get sort of diverted to them rather than to you.
Okay.
But I just don't know your particular setup.
Right.
So, we should probably talk, offline here, set up a meeting,
okay.
And we can talk through some of those particulars.
Okay. I have another question about my life insurance policy. Now, we have a free life insurance policy for $50,000. And I've been paying to have mine raised up. Does Holly have a contract or some paperwork that we can do something with our life insurance policy?
Excuse me. Yep. Hi, Vicky. It's Holly.
Hi.
So yes, I will be sending out portability forms for those that have the life insurance policy. So with this form, you will be able to basically port that policy out of PASCO into your own individual personal account that you would continue on if you choose to do that.
I'm sorry, I don't understand that. So like if I could put it in an IRA or something?
No, so it's not an IRA, so it'll just be an individual policy. So right now you have life insurance policy with PASCO.
Right.
You'll fill this form out and then it'll be Vicky's individual life insurance policy.
Okay. And that's just paperwork I have to do.
Yep, I'll fill a portion out and then there will be a portion for you to fill out. So I will be sending those out in February as well. And then you just send it over to the life insurance company.
Okay, wonderful. And I guess I missed the pay rate section. Is it on here somewhere?
It is. And we can get that to you, Vicki. We'll send out this presentation.
Oh, wonderful. Okay. All right. Well, And I am going to tell you, I've been kind of stressed out about this, but I'm really glad you guys had this today. For those of us that don't know how to do a lot of this, it really helps having somebody to walk us through this, if you will. This is a big change for my family.
Yeah. Yeah, it is a big change, and any change is kind of scary.
Yes.
Sometimes even if it's the greatest change, it's still kind of scary. So, and again, I just want to reassure that you guys can reach out to us at any time to ask additional questions, because you know how it is. We'll hang up on this call and you go, oh no, I should have asked that question. Well, we have additional meeting tonight if you want to join, but if you guys have other questions, please feel free to give us a call or shoot us an email or something. We're happy to jump in. We have this support team here that's readily available to help you guys.
I have a question for Holly. What's going to happen with the Empower 401k stuff that I've been having money taken out on a weekly basis to go into that account?
Yeah, so the account, you will have the option to roll that over if you have an individual retirement account, or you can set one up if you don't. So that way, should you choose to still want to contribute to that account, you can do that as long as you have an IRA. It'll just be obviously not within PASCO, it'll be your own account. And I will be sending forms out in February for that as well. It's a distribution form, so you can either roll those funds, you can withdraw them, or if you don't know what you want to do with the account yet, or you need some time to get something set up with a bank, there's no time limit on that. You can do that at your discretion.
But the deductions aren't going to be coming out anymore, I guess.
No,
Okay.
no.
All right. Thanks, Holly.
Mm-hmm.
Hey, Lexi, can you move the slide? Someone's looking for that QR code. Can you move the slide so they can see that?
I have a quick question.
Oh yeah, please go ahead. I'm not sure who said that, but whoever it was, please.
It's Pat Cox.
Okay.
I have both my daughter and my grandson. He was on the CES waiver, and now he's on the, what is it, IHSS?
IRSS.
IRSS? Okay.
Or wait, I'm sorry, your grants? I guess maybe I don't know who you're referring to. Sorry. I don't want to mislead you.
So my daughter's on the DD waiver.
Okay,
so she
okay.
goes to this. But he is still, I was his CNA and we just switched that recently. So I can still do him as an employee of PASCO and a subcontractor for her, right?
That's a great question. Kara, I'm not sure. Do you know the answer to that?
Pat, I was actually going to jump in and reach out to you as well. I would love to talk with you offline just about how that would work for your particular situation, because I know that yours is unique in the sense that there's two different service deliveries happening, like two different service delivery models occurring. And so I would love to set up some time with you to go over your particular situation regarding both service models.
Okay, great. That would be wonderful. Thank you.
I have a question.
They're all 3 days, sir.
This is Monique.
Morning.
So will we still be able to be tax exempt with the 1099?
That is our understanding, yes.
Is there something that we need to do to continue that, or will that just, we automatically qualify?
The type of work should make it so it's automatically qualified. But again, this is where we strongly recommend you probably consult with a tax specialist who could walk you through that. And then as we sort of indicated earlier, we can assist you with some guidance on getting connected with people who can answer those very specific questions for you.
And I will tell you, just to add to that,
whether it's tax exempt or not. I was trying to
Katie Schaefer did confirm with me yesterday that the taxability of the income, whether it's W-2 or 1099, has not changed. If you were tax exempt before, you're tax exempt now, and a CPA can make sure that, they can review how you report that, but it's nothing's changing on the taxability.
Okay, great. Thank you.
Thanks,
Can you address some of the questions in the chat box, Steve?
Yeah, let's take a look.
Here, and I'll read
Thank
them,
you.
Steve, if that's helpful.
Yeah, please.
So I'm going to go up to the top. It looks like a lot of the benefits questions Holly has been addressing in the chat. We'll also develop an FAQ to send out to everyone. So that way, if there are shared questions regarding benefits, we get those out to you all in one document. The first question that does not pertain to benefits is from Nora. Were you going to talk more about shared living? Answer any of the questions we added on survey. Are all Medicaid waivers impacted by this 1099 versus W-2? If
Okay.
the contract employee goes on vacation, how do we build daily rate? I'll stop there, Steve, if you
Okay.
want to answer those first two, and then I'll go to the next.
All right. Wait, that was a lot there. What was the first? Just give me one.
First question. Were you going to talk more about shared living?
Sure. I wasn't planning on talking about in detail about shared living or the shared living guide today because it's kind of a lot. And there's a lot contained in our shared living manual and our shared living guide. Is there a particular question that you want to know? Because if not, I'd be happy to. I mean, maybe generally speaking, I could answer. What are you asking? Like, kind of like, what does shared living mean, or what's more specifically the question?
Well, actually, you said you were going to share more about it, so I just was waiting for it. But I guess
Okay.
for me, we're still trying to decide if we are going to do this or not. And I don't feel like we have a lot of information going forward. And if I'm going to be signing a contract and a living guide and all this, I don't want to wait till the 4 days before this ends.
Sure.
And so I guess the more information I have to make the decision to stay with PASCO or not would be helpful. And so
Okay.
that's kind of what I was looking for. But if
Yeah.
and if the trainings are coming sooner than later, or this information sooner than later, that would be great.
Right. So we have the upcoming trainings that we'll talk in detail about that sort of stuff. And Nora, if you want to meet prior to that, I'm happy to schedule a call with you or even come to the house and chat with you about how this would look. I guess what I can do is provide a little bit of reassurance is that then short of changing this as your tax classification or your classification as an employee or a contractor, the day-to-day stuff really doesn't change all that much. The how you're going to again log your time and that kind of stuff is going to be the biggest thing, unless of course there's the SCC component. But otherwise, the guide is just going to sort of outline what's already being done. It's going to kind of put it in writing that's already being done. It's a guide, it's a manual, it's a reference tool.
Yeah. Well, and I guess like when you said signing a contract or things like that, I not red flags, but I just like, wait a minute, I don't know if I want to sign a contract. And I know that I'm an employee now and I have a agreement, delegations, and
Right.
work and stuff, but just I don't want to wait to the last minute to sign a contract and
Sure.
not be clear about what I'm signing, I guess.
Okay.
Thank you.
Yeah. So I'll reach out and we can get some more detailed information for you.
Can I ask another question?
Sure. Real quickly. I know we want to get to the chat questions, but go ahead, Shioma.
The question is like the training. Do you can I come over the office so that I have to know what I'm doing? Somebody have to put me through.
The question is, can you come to the office to receive some of the training?
Yes.
We could make arrangements for that if we need to do that.
Yes, I will prefer.
Okay. Or yeah, we can make that. We can make that happen.
Thank you.
Okay. So, Kara, what's the next question?
Yes, next question in the chat is, what are the considerations when there are two independent contractors sharing the care for a client/family member?
There's a lot of considerations. I'm inferring that question means sort of like how do we divide sort of who's being paid in that case, or how that's being paid. Is whoever asked that question, is that correct? Or...
Penny?
Yes, it's me. I mean, we both just sign into TheraP and do our time. So is that just going to be very similar? Because, like, for instance, my husband does a lot of the mornings during the week and I do the evenings. Is that going to be a problem with the change?
It shouldn't be a problem. What we'll probably have to do is, because it's not really like you're going to clock in and clock out like for that time as you're talking about. It's going to be like, we did this service or not. It's a daily attendance kind of piece. And so probably the easiest way to do that, if you guys are sharing that care, it's really difficult to split up a day in that sense, right? Because it's a daily rate. So probably what we do is we'd have to figure out sort of how many hours you typically do versus how many hours your husband typically does. And then we'll just divide the days. Like maybe you clock in for 4 days and he clocks in for 3 days. And then we issue those payments and the income to your home doesn't really change.
Okay.
Does
So we
that
could
make
do
any sense?
weekdays and
Correct.
weekends,
You
something
could do
like that.
weekends, weekdays, something like that.
Okay.
Right. And each of you as qualified caregivers can provide natural supports, right? As a parent, you're doing natural supports anyways.
Okay.
Right. So it's kind of no different in that regard. So maybe it's your husband's day, but you're doing some supports. You're allowed to do that.
Yeah,
It's
we
just
both
a
kind of
natural
do,
support.
yeah, every day, but we divide it in
Right.
terms of the key things. One other question, I don't, but my husband does some tracking of driving mileage for getting Kyle to his day program. Will that change?
The non-medical transportation should not change because the non-medical transportation is based on trips or miles rather than time. So that won't change at all.
They will document it the same way in Thera, all that will look
Correct.
similar.
Correct.
And they'll talk about it at the training and so forth.
Yes. Yes.
Okay. All right. I think I've had my questions answered. Thank you.
Thank you, Penny.
Mhm.
Okay, the next question in the chat is, as an independent contractor, does our liability increase? And then there's a second question that ties into liability. Will we need to obtain liability insurance?
Great question. Simply put, your liability would not increase in this sense. It is not required for you to obtain professional liability insurance. But some independent contractors, whether family caregiver or host homes, choose to do that. And there's a couple of different ways that can be done. One is you can get professional liability insurance through, well, there's a handful of places that do it. Principally, there's a place called Flood and Peterson who offers this insurance. It's relatively inexpensive if you want to do that, although it is not required by rule and regulation. Another thing that people do often is they will just contact their homeowners or renters insurance, and they might add an additional coverage in the form of like an umbrella policy or something. It's really just a matter of preference for how you want to do it. Where I would say that the additional liability may come up is if you are having someone who's sort of like a non-family member coming in to do respite or something like that, and they're coming into your location, that might be something that's more of a consideration. But otherwise, it's kind of the same.
Right.
So the liability would be the same as like a workman's comp if you got hurt.
No,
No, that's a different
no, workers' comp would not apply
at all.
at all, as it does not apply to independent contractors.
Okay.
And if people were interested in the professional liability insurance, that's another thing we could hook you up with Flood and Peterson. I've worked with them for years and years and years. We could hook you guys up with them to get the specifics of that if you wanted more information.
Alrighty. Next question is, can someone put the QR code back up on the slides? It looks like we have it there. So that is up and ready for you to scan if you would like to register for one of the upcoming trainings. The next question, Steve, is, does PASCO still get the administrative fee for managing independent contractor?
Yes. I don't know if there's any more to that.
Nope, that was it. Sorry. I just
People,
wasn't
if
sure
you
if you were
want
going to go.
clarification on that, that's the one slide we talked about what those rates are going to be and how we've adjusted the rates to where you're going to be getting 68% of the rate now versus 63.3, which is what was prior. So we're getting less of that rate. You're getting more of that rate.
Hi, I have a question. My name's Sarah Carrasco. Is it possible if we could just quickly look at that rate of pay again on the screen?
Yep, there you go.
Thank you. And I guess I do have a question for Holly. So, I've been with PASCO a really long time, and initially we had burial insurance. Is that going away, or did that go time ago? I just didn't know it.
Burial insurance through Colonial, or
Well, when I started with PASCO like forever ago, we got a $50,000 life insurance policy, and it was initially like, I think it was 15,000 burial.
yeah, so you have the $50,000 life insurance still in place, and that you will receive a portability form that I'm going to send you. So if you want to keep that policy and just do an individual, then you'll fill that form out and send it to the life insurance company.
Okay, I see. And then just a quick question about retirement. So if we choose to take the distribution, are we penalized for that?
You are if you're 59 and a half years or younger. You have the regular tax, and then you'll have early withdrawal penalties as well.
I see. Okay, well, that's all the questions I had. Thank you, Holly.
Yeah.
Thank you, Sarah.
Zephyr, I had a quick question on workman. Like, let's say something happens while you're providing care. So does workman's comp that would go away as well, right? Since we're an individual contractor.
Yes, correct. You would not be covered on PASCO's work comp.
I have a question that I've asked in the chat a couple of times. My daughter qualifies for a staffed home, and I need to understand how this change will affect our situation. Does this mean that I have to be an independent contractor and pay the individual staff members who come in and provide care for her? She has several that come in on a schedule. I was assured by the state that because she's in a staffed home situation, that this rate change would not affect her. So I'm very confused about how PASCO intends to handle that.
Yeah, Charlene, that's probably you have again one of those unique situations. So I know we've spoken in the past. Maybe we could set up a meeting again to chat about that. The staffed home stuff, I know we talked about that a few months ago. I haven't heard any new information on that and how they're interpreting that. So we'll have to explore that a little bit more. And in your particular case, we can talk about the particulars of how that would work with those staff coming in and out. In a very theoretical sense, they could become independent contractors as well. And then we can issue those payments that way. It might get a little bit tricky, but we should be able to figure that out.
Well, that was my, in conversations with the state, that has been their interpretation. I've had that interpreted legally or illegally through the legal center and places like that. And they've assured me that they are all considered independent contractors and that is how this should be administered. But I'm wondering if PASCO has sought guidance from the state or received any from anybody else about how to handle a staffed home situation. It's quite different from what most of the family contractors that you have here today have. And so it's very confusing.
It is a little confusing. And Charlene, yeah, we were on the same calls when the state was discussing that. Again, I have not heard any new information, but I can certainly check in with our trade association and with the department to see if there's been any updates or changes on those interpretations.
Okay, well, I need this sorted out. How do I get that done? Can you arrange, you and Michael arrange a time to sort this through and set up a call for us, I would really appreciate it.
You bet.
And,
Will
and
do.
Steve,
Yes.
Luann Billings, how are you?
Good. How are you?
Good, good. I do have a quick question regarding, because we are still an employee of PASCO January, February, and then we have the payout of our vacation. When will we receive? I'm assuming we'll still get a W-2 for those 2 months. Is that correct? And when will we receive those?
The W-2 for anything that occurred
I
this
mean,
year?
Correct.
So the
What will that
W-2
look like to?
for anything that occurred this year would be on the normal tax cycle,
Okay.
which would be, next year, right?
Oh, next, you're right.
Correct.
Okay, I was well, see, I was way ahead of the game.
Very prepared.
Okay, so that'll come next year. You're right. Okay, that's it. And thank you for this meeting. Thank you.
Of course. Now we're getting down, we're just about out of time. I don't know if there's another question that we have in the chat that we want to make sure we get answered. Again, there's been lots of questions in the chat. I'm sorry we haven't been able to get to all of them, but we'll do our best to put together an FAQ. And again, we're going to be having some additional trainings with more detail that should help to clarify some of this stuff.
Will this particular cast be shared? So like if somebody wants to view it later, will this?
Yeah, we are recording this and we could do
and
that.
it'll be
Yes.
shared later.
Yeah, we can
and
do that.
accessible. Thank you.
Can we get a printout?
I don't know that we can print out this meeting per se, but we can certainly print out the slides.
That would be great. Thank you.
I do have one last question.
Yes.
Okay, so I'm looking at the rate of pay, and it looks like, so for example, like CIS level 4 would be $140 for 1 day, the rate of pay, but it looks like, if I understand this, like PASCO is collecting 20, or the rate of pay for them is 207, so that's a difference of like $67. Is there a way to negotiate like up? Can parents negotiate up? Because 67 per day, like per family, is quite a bit when we're no longer getting like life insurance and health insurance and stuff.
Kara, I don't know, maybe I'll defer to you on that one. Are you still on the call?
I'm here.
Okay.
So regarding our administrative rate, if we can go back to that slide regarding rates, just so we have it visible to everyone as we're walking through this. So our administrative rate is the portion that you keep, Sarah, of the daily rate is 68%. So we're providing 68% back to the families when it comes to the administrative rate. So there's the rates that you're seeing here that are displayed on the screen are after the 8% rate reduction. After our new administrative rate, the family is keeping 68% of that reimbursement that comes with the residential program.
As opposed to the 63.
Correct.
That's correct.
Yes.
I see. Okay.
Yes.
Thank you, Kara.
Yes, of course.
Okay, so we're just about out of time, or we actually are at time. So I'm going to go ahead and we're going to end the call. But again, I just thank everyone for attending and being so thoughtful and asking these awesome questions. I know this is a huge change and a big change, a scary change, as it is for us too. But we are committed to making this as smooth as we possibly can. I've taken some good notes here. There's a number of you that we'll be following up with. And if any of you, again, have other questions as time goes on, please feel free to reach out and we will do our best to make sure we get these questions answered for you and make this as smooth and as seamless as we possibly can. I'm really looking forward to it. I think overall this is going to be a really nice change for everybody. It may not feel like that now, but in time you'll see that this is a much better way to actually operate this service. It'll be smoother for you. It'll be smoother for us. It's just the way to go.
Thank you, Steve. We have one more informational session this evening. You are more than welcome to attend that session as well. Our goal is to compile all the questions that everyone is asking and get an FAQ out, hopefully distributed to everyone by end of week, if not early next week, to allow time to get us the questions and answers populated. It's good to see everyone. Thank you.
Thank you.
Thank you.